Welcome to the PharmaVOICE 100 one-on-one video series with Taryn Groen.
Hi, Caroline. Welcome to the... Now I messed up. Hi, Caroline. Welcome to the 24-hour celebration marathon.
Thanks, Taryn. It's great to be here. Nice to see you.
Good to see you, too. Caroline, talk to me about how you're redefining the customer experience in light of COVID-19. I know it's changing everything.
It is. And, for the customers themselves, they're just operating in fear and uncertainty. There's new challenges that are coming their way. And so, everything that we're doing is really around helping make sure that we're addressing that fear. We're staying connected with the customer. They have things going on internally, decisions they need to make, budgets stopping, starting, decisions about patients. And so really staying connected to what's happening with them and what they're trying to accomplish, but then really staying connected to what's going on in the industry, by country, by state. Regulations are changing, who can travel is changing, what patients are willing to do or able to do, and the same with sites. And so really that whole connection between the customer, the patient, the sites, the regulations, the changing environment, and really focusing on what they need to get done to meet their goals. And so some of that's hybrid models between remote visits and on-site visits, and that could be with patients, that could be with clinical monitoring, that could be a number of different items. Of course, we implemented a lot of new telehealth technologies, so really trying to accommodate what the need is for what they're going through and what they're still trying to accomplish.
Excellent. And all of that has changed, right? So it's changed for the patients, it's changed for you all. So how are you inspiring your teams to embrace the changes that are coming their way? Because changes
it's hard. I think, the most important thing is really understanding how that change will help someone, how it will help a patient, how it will help a site, how it will help a customer. And I think when people can connect the dots between what's happening with the change and what the good of it is, that's the way you can help inspire people to make the change. I think everybody's going through a lot of change in their personal lives, in their professional lives, in their companies, in their industry. And so, trying to make sense of things that we can do to help each other, to help the customer, to help the patient, which at the end of the day is why we're all here. And so, if we can tie what we're doing into that, I think it really helps inspire people to jump on board with the change. And I think people are looking for solutions and change in this kind of environment right now.
Excellent. And have you had your teams come back to you and say, this is new uncharted territory, but it's challenging, but it's fun?
Sometimes, yeah. I mean, really to have all the agencies and the regulators jumping behind this has been very helpful in an industry that's been pretty risk averse. I think it's excited the teams that now these might be possibilities that we can implement even when we're through the COVID challenge. And so how is that really going to change our entire industry? And so I think, there's a number of people who are pretty excited about that too.
Awesome. Well, Caroline, thank you so much for spending a few minutes with me, and thank you for being part of the celebration.
Yeah, thank you. Happy to be here.
For more PharmaVOICE 100 content, visit www.pharmavoice100.com.